Good afternoon and good morning to everyone, depending on where you're calling in from. It's good to have everyone on the webinar today. Really excited to dive into this topic with our partners at House Mom and with Beth Alford at Mitigation Solution. Just to get through some quick housekeeping items before we get into the heart of the presentation, just to kind of give you all a little bit of background. If you haven't met me already, my name's Steve Vandervelde, and I work as the Director of Senior Living Partnerships at Provinet. Provinet, again, if you haven't heard of us, basically at our core, we're an IT services organization, but we focus in senior living. And the biggest reason for that is we're born out of a faith-based, not-for-profit provider ourselves. So for all of our customers across the country, we might be their outsourced IT team, or we might help augment an existing IT team. But then we also do a lot of EHR consulting as well, and have a pretty large part of our team dedicated to that, made up of informatics nurses, financial consultants, and data specialists. That kind of actually led us to our partnership with House Mom. I know we've done, it's been a while since we've done a webinar with you all, but House Mom kind of came to our radar because we kept getting asked, hey, who do you recommend for a product that can help with risk mitigation, notifications across the community, but also a portal into the residents' EHR that's safe for resident and family viewing. And that's kind of what initially started some of our conversations with House Mom. And it's been exciting to kind of see how they've taken off in the years since, and just kind of how the product has spread in terms of what it can do and how it can serve our senior living population. So yeah, always happy to have House Mom on the webinar here. And going to actually take this chance then to hand it over to Rich and Beth. And Rich, I'll let you kind of kick it off to introduce yourself, and then hand it over to Beth.
Okay. So my name is Richard Brown. I am the Director of Sales for House Mom. I am very excited to be able to get a chance to speak to all of you today. I am even more excited to listen to the wonderful words and wisdom of my co-presenter, Beth. So I'll allow Beth to introduce herself, because she's the real star of the show here.
Hi, everyone. I'm Beth Alford. I own Mitigation Solution, and I've been a long-term care nurse for over 30 years. And I was so excited when I learned what House Mom was, because we're going to get started on the slides in a second, but I didn't know until the last couple of years that there was something called the Cures Act, and that we had to be compliant with it. And so what was exciting for me was to find out that not only could all my nursing homes be compliant, but they could also make much happier families. So with that, let's get started. So one of the big things that I love is how time saving it is. And you guys know, as nurses, how long it takes to make calls, to receive calls, and how angry family members get when they call a facility and either the phone doesn't get answered, or they say, yeah, somebody will call you back, and nothing happens. So we're going to be able to do notifications to families about med changes, about appointments, about lab results, about minor incidents. And then it's also a way to prove response to resident and family grievances. And that's a big issue. I read surveys every week, you guys, and that's one of the things I see written up, is that there's no proof that a family's complaint was dealt with. It's also a great way to update family members on the general welfare of their loved ones, because we all know how hard it is when a resident is placed in the facility, how hard it is for them and how hard it is for their loved ones. We also can update family members on physician visits, what the doctor or the NP saw them, what was said, any new orders. And then also on lab results, because a lot of families are keeping a close eye on family lab results. For example, if they've had someone with a low hemoglobin or hematocrit, to update them on how those numbers look, or if their white count's been elevated with an infection, how does that look? So we'll go on to the next slide. And continuing on, it also helps with care plans, because notifying families about care plans can sometimes get thrown to the wayside. And this is a great way to set up your care plan meetings. It's also an easy way to notify families of facility events with a global send out. And if there is, heaven forbid, a infection outbreak of some type, notifying families of that in a global way without taking so much staff time to do that. And then responding to family questions and concerns. There's a wonderful part of this application is that people can go in and rate how they think the facility is doing. And I look at those every week also. And it pleases me so much that, there's a lot of 4 and 5 stars. And sometimes there isn't, but it's because they've had a clear issue and the facility hasn't had time to respond to it yet. And that can lead us on to getting some tags. So if we go to the next slide, I wanted to talk to you about the Cures Act. In case some of you didn't know, like I said, it's something that I'm seeing that a lot of my facilities are not very well aware of. And this started back in 21. And the whole purpose was simply to allow patients, in our case, residents, to get unrestricted access to their electronic health information, and that it's illegal to try to block it. And it was imposed on the health IT developers to enforce this by ensuring that the EHI platforms are adequate. I would say that in all of the homes I look at, the biggest percentage are probably with PCC, and then the rest with Matrix, and then there's a few different ones thrown in there, but for the most part, that's how it works. And that if the IT developers, like PCC or Matrix, can face fines for non-compliance up to 1 million if for per instance if they block anything. And now they haven't come up with provider penalties for us yet for the nursing homes, but they'll be subject to appropriate disincentives. So we all know that means nothing at this point, and HHS is going to come up with a rule, and they're going to come up with penalties for us. Next slide, please. So individuals shall securely and easily obtain and use electronic health information from the provider's medical record for free. And it says they can use a smartphone app of their choice. And also, it's something that just to remind you, remember the resident has to be authorizing what family members can get their health information. I like to remind my homes of that, because even when a resident's admitted, remember, they should be signing their own paperwork unless they're not mentally competent. So the data that has to be accessible is a standardized set of health data classes and data elements. And it's intended to set a foundation for broad sharing of electronic health information to support patient care. Well, it's meant to be a way that residents, family members can have access to their health information and get it online. I know I've seen, even for me, when the rare times I go to the physician, now I get a note that my visit information is online and I can go in and look at it. All right, next slide, please. So moving on with the Cures Act. So most of this, this information is already in your system. If you're using PCC or Matrix or one of the other EHR systems, the patient information, the vital signs are in there, overall health concerns, what lab results there are, what their medications are, assessments done by nursing, assessment done by the physician or the NP, what their plan of care is, what their care team members are, the progress notes, patient goals, etc. All of that is available for members to look at. And all healthcare providers have to comply with this. And that includes not just skilled facilities, but also assisted living communities and home health entities and other long-term care providers. So it helps make communication so much better, because we know making and receiving calls from family members can be very time consuming. And family members need to know when there's changes in orders and diagnoses and general health. It's very upsetting when a family member finds out that their mom has been running a temperature and not feeling good for 3 days, and then all of a sudden find out we're sending them to the hospital. Well, this is a way for them to know as things are happening. And as I said in the beginning, when a family member calls the facility, guys, I get it. I've been in long-term care forever. And it's difficult sometimes when there's thousands of things going on for a nurse to be able to take a call. And I understand that. And this way, family gets their information, they can feel better. And best of all, it gets addressed in a timely manner. So I love using How's Mom because of how much time it saves and to help us avoid tags. On the next slide, we're going to talk about the tag numbers. And granted, now CMS hasn't said that these tags will be written up for this, but as we all know, CMS will easily write tags that even come close to certain tag numbers. They will throw that into the tag. And so what I did was I went through the regs and came up with the tags. I could see them start writing now, even before there's an actual so-called penalty put in place by CMS for this. So F551 says we have to treat the decisions of a resident representative as the decisions of the resident, to the extent required by the court or delegated by the resident. And so again, if you've got someone who's incompetent, then they are the resident's person who will make those decisions, whether it's a POA or otherwise named family member, and they have to have access to that information. And then on 580, we have to immediately inform the resident, consult with the physician, and notify the resident's representative when there's an accident, which results in injury and has the potential for requiring physician intervention. And as we all know, even if there isn't an injury, we notify them. And then, of course, a significant change in the resident's condition. And that a lot of times I see this one written up because families didn't know that there was lab work that came back that had some issues, or that the person was suddenly, running a fever. And these are things that will automatically go in and be addressed. On the next slide, we're going to carry on with talking about some more tag numbers. So it says the facility has to promptly notify the resident and the representative when there's a change in room or roommate assignment. And we know how difficult that can be to get done on time, and this takes care of it. Because when it is put into their record, resident will be moving from room 120 to room 110 to be closer to the nurse's station. Well, that would automatically go to the app that the family member had so that they would know. Then if there's a need to alter treatment significantly, for example, this is for not just adding a new treatment, but also discontinuing the treatment. Because again, I've seen angry comments from families who didn't know that a diet was changed, or that someone's medication was changed. Obviously, decisions to transfer or discharge the resident from the facility, it must be communicated to the family, and having social service notes to be able to whenever they do the review of potential discharge, for those to be able to go to the family member so they're in the loop. The facility has to promptly notify the resident and the representative if there's a change in room or roommate assignment or a change in resident rights. Well, guess what? I just realized I doubled that. I apologize, everyone. It was just a test to see if you were paying attention. All right. On the next slide, we're going to talk about more tag numbers. F559, that's the right to receive written notice before the residence room or roommate is changed. That's the tag that we just read, but it's a different tag, so they can write it twice. Gosh, that never happens, right? No one gets the same issue on multiple tags. 585 is grievances, and that's, as we talked about early on, the resident has to see, the family has to see that we made prompt efforts to resolve the grievances. Care plans, have to include goals for admission and desired outcomes, the resident's preference and potential for future discharge, and if there's any like local entities that we would need to be contacting, for example, one of them is several locations have nearby places that are like places where a resident, when they live at home, somewhere for them to go on a daily basis, just to have company and see someone. Also, if they need referrals to an eye doctor, a dentist, whatever, so that those are part of their discharge planning. And then, of course, the discharge plan in their care plan. And that is, for example, when they're going to get a notice of non-Medicare payment when their Medicare runs out, that is something that you can give advance notice to families by using House Mom. It goes right in there. It saves us making a phone call or sending an email, and it just makes it so much easier and so much better use of our time. On the next slide, we are going to continue with tag numbers, and F657 is another one that we have to say if the resident or their family member isn't able to participate in the development of the residence care plan, that we have to be able to show that. And for example, I've had where residents gave authorization for maybe a son and daughter to have access to House Mom, but didn't want a sibling of theirs to have access to House Mom. And that's meaning they don't want them looking at their care plan either. Under 756, drug regimen review, physicians make med changes. Sometimes when the pharmacist comes in for the monthly drug regimen review, they will say, okay, this drug could cause a potential problem. It could have interactions with this or that. And we've got to address those. And as an aside, I see 756 written up way more than I used to, because, when you're reading the records, those changes, those recommendations are in the chart, but we need proof that they were communicated to the family, and this takes care of it. On 775, that we have to file lab reports that are dated and for whatever reason contain the name and address of the testing laboratory. Who knows why CMS writes some of these tags the way they do, but they do. But at any rate, like I said before, this is great because lab results are going to go right to the family members assigned by that resident so that they can see what the results are. And as I was telling you, in the case of the patient who had very low hemoglobin, the families were very anxious to know how it was going and how that person was doing. Okay, moving on. I'm going to pass it off now to talk about the way senior living communicates care for a world that no longer exists. Thank you all very much.
Thank you, Beth. Thank you. So again, my name is Rich. And I like to start with, kind of talking about our origin story. When I'm out, all throughout this country and multiple different conferences and events, one of the very first questions people ask me is, how did you guys get started? How long have you been around? Tell me a little bit about yourself. It's kind of like the speed dating version of a conference. Um, and I like to say that our origin story really isn't any different than anybody else's origin story. You know, our company was started when our founder, his grandfather, who was an avid skier, had a traumatic brain injury and he was sent into long term care. And the family was not able to get the updates that they wanted, that they needed. That's no different than what so many of us deal with on a day to day basis, whether it's in our job or whether it's for a loved one or family member who's been placed in one of these settings. There is, just being transparent, there's an inherent guilt when I have to go and say, hey, I have to send my mom to a long term living situation. You feel bad about that. It doesn't feel great all the time. Mom may not feel great about that. But one thing that helps bridge that gap and one thing that helps make a lot of people feel comfortable is when they are put in a facility that communicates, right? That that you could call, you're getting the information that you need, you know what is going on with your loved one 24 hours a day, 7 days a week. Like you have a good idea of what's going on. So one of the things I found when, going through facilities across this country or even talking to so many people from so many different places, from so many different spots, all throughout this world, even, right? The way senior living communicates is perfectly suited for a world that no longer exists. What does that mean? Right? It is 2025. A lot of your residents are on mobile devices. They are using the internet. They are using these tools that have become inherent in every single one of our lives every single day. If I go to my own doctor and I go get lab work done, or I go to the emergency room or anything like that, I have a My Chart or I have an app to where I'm able to look at everything that is going on with me. Why are we not able to communicate this way in senior living? And quite frankly, it's because it doesn't exist, right? There aren't a lot of solutions that allow facilities to be able to provide this communication, but also not place a burden on the staff that's inside of the building that is supposed to be providing care to their loved ones. But not just our word, right? Let's look at what people are saying about this, right? Less than 50% of family caregivers are satisfied with the amount and timeliness of the information they receive from senior living communities. So, family caregivers are just as concerned about communication as the experience and quality of the care that their loved ones are receiving. I read this really interesting study published by the National Institutes of Health and published in the Journal of American Geriatric Society, right? That 30% of RNs exhibited high levels of burnout, 31% were dissatisfied with their job. And of that population, 72% of them reported missing one or more necessary care tasks on their last shift due to lack of time or resources. These are nurses that are just trying to get through their shift. They are just trying to make sure they can provide the best care possible. But because of the situation and the circumstances that they are placed in, they're not able to get everything done. That doesn't mean that they're bad at their job because they're missing something. It means that the system and the processes that we've put in place for them are broken. 1 in 5 RNs reported frequently being unable to complete necessary patient care. And so they looked at these nurses and they talked to these nurses and they said, what are the tasks that are most often not done during a shift? And these are some of the most important pieces of the equation when it comes to our communication with our family members, our loved ones, our POAs of care, whoever that person may be on the other side, is comforting and talking to patients, providing adequate patient surveillance, patient and family teaching, and care planning. So I like to start every single conversation that I have with a new organization by asking them two questions, right? How do you currently communicate care? How are you providing updates to family members? What is the expectation for family members if they would like an update from your facility? And the number one thing that I hear all of the time is that they call. They pick up the phone and they call. And I say, okay, that's fine. They pick up the phone and they call. And then I say, how long are those phone calls? Those phone calls, when we're communicating a change of all of the wonderful F tags that you could get um, from auditors that are gonna, looking, breathing down your neck and saying, hey, did you do this? Did you not do this? Right? Say it's just a change in room where you are required to notify that family member and you have to pick up the phone and call. That could easily be a 20 or 25-minute phone conversation. You've just taken a nurse off the floor for 20 or 25 minutes to communicate a room change. The second question I ask people is, how do you prove it, right? How do you document it? One of the things that a lot of facilities will tell me is that, our nurses will pick up the phone, they'll call, they'll make a note in the chart. And so we'll say, okay, great, let's go look at it and we'll do a deep dive, or Beth will do a deep dive. And, we'll find out, we'll go look at the notes, and the notes will say, hey, I called Tim on Tuesday, January 30th, and that's it. Okay, so what did you talk to Tim about? What did you communicate? How did you document that? So when the state comes in to perform an audit and they say, hey, show me the proof that you communicated with this family, there actually is none. There is none. And that is the scariest piece of this. So how do we bridge that gap? What we like to say is, imagine if we could automate 80% of all of your required care communications. What if we could eliminate the need for your staff to always be on the phone while maintaining compliance with automatic documentation, and most importantly, provide families with the information they want and they need when they want it? This solves all of the problems that are inherent in not just the 21st Century Cures Acts that are requirements, but it also helps make our families happier. It helps provide our nurses the time and space they need to be able to do the jobs that they're supposed to be doing, which is spending time at the bedside with the residents of all of these different communities. So we created a platform that is omni-channel. It is directly integrated into your electronic health record. There's no need for a nurse to interface with our platform in any way, shape, or form. And we are able to automatically communicate and document all required care communication. We're able to communicate between staff, families, and residents. You're able to send mass notifications. You're able to invite outside providers to the platform. You're able to provide community engagement updates and calendars so families can go in and see what is happening in the building on any day of the week. And then ultimately, we're able to provide a global view for leadership of what is happening across all of their buildings for some of these organizations that have, 30 plus buildings. How do we provide them a global view to see what is happening across all of them? So our platform is omni-channel, meaning that we have app, web, text, and email alerts. So families can go in and decide, and we can go in and decide when we're doing an implementation of how does a family member like to be communicated to. What I'm showing you here on a screen is an example of an email and a text message notification. And so everybody's first question when we're saying, hey, like you're texting out information, how do you maintain HIPAA compliance? But as you can see here, right, all of our notifications are directing family members back into the platform that they need an invitation to be able to get into. So we are not sending medical information via text message or email. We are sending them alert to say, hey, this happened. Go into the platform and go look at it to find more details about it. Now, when that happens, when this text alert or this email alert goes out to those family members, that documentation, that notification is automatically written back into their EHR. So there is no need for a nurse to do anything different for a room change other than chart a room change the way that they've always charted a room change. And our platform will pick that up, automatically send out the notifications of who's required to be notified of those changes, and then write that back into the EHR and say, hey, at this date and this time, this information was communicated to these different people. So it's keeping us compliant. It's also giving our family members the updates that they need, and it's keeping nurses off the phone. We are also able to send out mass notifications. So if there's a COVID outbreak, we're able to input community events, whether there's bingo night or casino night or whatever activity is going on in the building. And we are also able to invite outside providers. So if they have outside physicians or nurse practitioners or whoever is part of their external care team, we're actually able to send them an invite as well into this platform so the information can exist in one spot. Finally, we have a global view, and this is what I was talking about, a global view for leadership. So we can see here, this is a screenshot of what it would look like if I am, a chief nursing officer and I wanted to look at 4 different facilities, right? I can see the total number of issues that are happening inside of that building. I can see the average rating of my facility. I can see how many of my issues have been resolved, how long did it take to resolve those issues? Because inside of the platform, family members are actually able to go in and submit feedback. So if I go and visit my father and you notice that, hey, it looks like dad hasn't been changed in the last 5 hours, I can go straight into the platform. I can send a note straight to the facility and say, hey, it looks like dad hasn't been changed in the last 5 hours. And if I give that feedback a low rating, the administrator in the building will automatically receive an email notification say, hey, you just got negative feedback. This prevents, for me, a great way to prevent escapes, right? Escapes outside of the building. We can keep this problem contained, and it prevents people from going online, going to Google, going to Facebook, going to Yelp, wherever they want to air their grievances because they feel like they don't have a pathway to get a hold of the facility. It also gives those leaders inside of the building and at the organization level, hey, we're getting a lot of negative feedback from the Johnson family. This might be a good time for us to go in and talk to the Johnson family and calm them down a little bit. Let's clear the air, and let's cool things off a little bit. So I wanted to open it up for questions. I wanted to kind of just give a brief kind of overview of the platform and what we're doing and how we take it on. So I'd love to hear any questions that anybody has.
Yeah, no, thank you, Rich. Thank you, Beth, for the education there. Just a reminder to everyone on the webinar that if you see the Q&A button up at the top of the screen, you can absolutely post your questions there. So please use that feature, and we'll kind of monitor them, and I'll pose them to Rich and Beth. First question I did have came across as when an organization is implementing HouseMom, who typically needs to be involved in the implementation process, like what disciplines, and how long is the implementation process?
Yeah, that's a great question. So typically, we usually like to say that there's 2 to 3 key stakeholders, and that would depend on the size of the organization of what disciplines would be included in that process. But typically, we like to see at least the ED, the executive director in the building. There is quite frequently, someone from your technology team just, helping build that connection between, say, point click care and our platform. and then like a chief nursing officer, somebody from the clinical side. So it's usually only about 2 to 3 people. The total time for implementation is we like to spread it out over 3 separate meetings that are really only about 30 to 45 minutes each. So it's relatively quick and easy. It's mostly just training for the individuals that are going to be using the platform. But more importantly, it's providing education that can be shared with the community, because this is a change. This would be a change for your community, that you're turning on this platform that gives them access to information. We like to be very mindful in helping organizations roll out that messaging, and how do we communicate this information.
Got it. Okay. Um, and then another question was, do you see any difference in the benefits with automated communications between SNFs, ALs, and ILs, or are the benefits kind of similar across the different levels of care?
I think the benefits are very similar across different acuity settings. Obviously, skilled nursing is going to have the most impact, but that doesn't mean in a CCRC or an independent living situation, right? That, like we have a lot of communities where the residents are on the platform because they want to see their own information. Um, so no, it's just how the information is used is the only difference. Who is accessing it and how the information is used. We have
Rich?
like I said, yeah.
Oh, I'm sorry, didn't mean to interrupt. I just wanted to say from the assisted living facilities I've talked to, they are amazed at how excited family members are,
Mhm.
because they just feel like in the past that they really didn't get any updates or information, and they are just ecstatic that they're hearing and seeing what's going on with their person right now. It's
Mhm.
just amazing.
Yeah. I mean, it quite literally doesn't exist in a lot of facilities throughout this country. It just does not. And that's not hyperbole. That's not, colorful language. It's just true. It's just facilities aren't sharing this information. And there is a lot of times a reason why, right? There is an inherent fear of sharing this information, of like, oh, wait, I don't know that I want family members to see this information. One of the pushbacks we get is, I don't want to share vital information. I don't want to
Mhm.
share medication passes, right? And we have safeguards in our system. So something like, sharing medication, which is required, right? We don't share medication pastimes, right? We just show the current medications that a resident is on. That helps protect the facility from getting a phone call to say, hey, you gave mom her medicine at 7:15 today, but you gave it to her all last week at 7 o'clock. Why are you guys late? It's like, they're not late. The nurse probably just chartered it 15 minutes later.
Yeah.
um,
Well,
and the
we also have
medication
it.
was,
We have an hour within the allotted time to give the medication.
yep.
Mhm. Yeah, and that's a really good point. Just like you said, Rich, like that's kind of what we've been seeing too, is so many communities just don't have a good means of sharing that information. And I think that's what we liked about House Mom is it's you're getting an app to see the information as a family member, but it's a proctored view, right? It's not unfeathered access into the electronic health record. It's really just the information that they do need to see uh, presented in a way that's easy to understand and digest. And that's kind of like the expectation now. If I think of, what my healthcare looks like, my provider down the street, whenever I have a checkup or labs or anything like that, like I'm getting onto their version of my chart, I think it's called. And like that's what I'm used to. And if I'm, in my 50s and my parents are in a community, I'm going to expect that that community is going to have something similar. And it's just, yeah, kind of the opposite expectation. It's just like, well, so many of them are, well, we'll print that out for you, or we'll share what we can. And it's just a really antiquated approach, I feel like.
No, I mean, I'll give you, like you were completely correct, Stephen. My wife she had emergency surgery a couple months back, and she was having a lot of testing done. And quite honestly, we were in the My Chart looking for the documentation of how the testing was going before the doctor even had a chance to
Yep.
walk in the room. Like we knew, the radiology report before we talked to the radiologist.
Yeah.
And people do expect that level of information. And I understand that it feels like we have a long way to go to be able to go from zero to start to sharing information as a facility. But it quite honestly, the platform can be turned on in under 45 minutes and get you up and
Mhm.
running. We spend so much of our time just educating and how to communicate that there is going to be this change and how this is going to look for your community now.
Yeah. Yeah. That's a really good point. Um, just another reminder, if there's any more questions, please put them in the chat here. We'll keep an eye on those for the next few minutes. One question I just thought of, Beth, for you really quick is I know, I guess from where I sit, like I get to hear about the Cures Act from our customers, and I'm not nearly as knowledgeable of, what that all means from a regulatory standpoint and what it could mean for a community if they're not complying with it. But from what I understand, it's pretty clear in terms of, that if somebody requests records, they can expect them within a certain time frame, and if you don't provide that, you're going to get in trouble. I guess, do you have any, like, what's an actual, like, war story almost on and that you might have heard from a customer who kind of got in trouble with that Cures Act, just so we know what we're dealing with?
Well, there's always been under HIPAA, there's always been a requirement that you have um, up to, I believe it's 10 days, 30 days, it depends somewhat with the state organizations, to provide a copy of medical records. The Cures Act, on the other hand, says that you need ongoing access,
Okay.
that you shouldn't have to request the records, that you should just have access to the records. And that's what makes this a whole new ballgame for long-term care, because that's never been in effect before. And like I said, I deal with literally 100 or more nursing homes, and I I just feel bad for them because so many of them don't know anything about the Cures Act until we
Hmm.
talked.
Yeah.
And so hopefully this is a way that it'll just also help spread the word.
Yeah. Yeah. No, that's great. Um, all right. I'm just looking at the questions here, and I think we got through pretty much all of them. So, with that, I think we could probably go ahead and close out the webinar. I guess, Beth, Rich, any parting words of wisdom for us before we shut things down?
For me, if people need to contact us, please do. I'm glad to answer any questions that I can. Of course, I'm not um, savvy technology wise. I know how to use my own computer, but I am very impressed that someone like me who's not that brilliant with it, it's very easy to use. And one of the things I really love is, as you guys mentioned already, is that administration has a way of looking to see what family concerns came in and how quickly they've been addressed. And as you guys remember when I talked about grievances and that tag, this helps take care of that so efficiently. So that's all I have.
Yep. Yep. Yeah, I think thank you, Beth, for saying that. I think I just want to end on, we don't ever go into a facility or partner with an organization because we believe that we know the right way to do things, or we know the right situations and how to handle all of those. Those are the experts like Beth to be able to do that. Talk to Beth about that. We just simply want to acknowledge with our technology of just giving you a solution that makes your life easier, right? Your job is very, very difficult. I could never imagine, having to do the job of a nurse every single day. It is exhausting. It is draining. It is thankless a lot of times. It is it is vulgar a lot of times when you're getting
Yeah.
screamed at by people. And I don't think people stop and think about that enough. I don't think people stop and say thank you enough to the people that are working inside of these buildings, you know, all the way down to the CNAs and LPNs, right? They have a very difficult job to do. And that should be acknowledged every single day, because at the end of the day, they are taking care of our loved ones. So, you know, from me, from the bottom of my heart, like, thank you. If you don't hear it enough, thank you. If a family member doesn't say it, thank you. Because even though they're not saying it, they do mean it, because at the end of the day, they leave and go home and you are still there. So thank you, everyone. Thank you for the work that you're doing. I could not respect it anymore.
Very well said. That's awesome, and I think that's something we don't touch on nearly enough in the industry. Just recognizing that it's hard work, but we have great people who are still committed to doing it. So yeah, I just wanted to thank you, Rich and Beth, for a great webinar and for helping us, you know, learn more about the Cures Act and the House Mom solution. I want to thank you, all the attendees who made time to join us today as well. We're going to have this recorded, obviously, and for anybody who missed it or had colleagues who weren't able to attend, we'll have the recording out and accessible probably within a few days here. So yeah, thanks everyone for your time, and hope everyone has a good rest of the day, and we'll see you all in the next one. Thanks.
Thank you,
Bye.
everyone.
Thank you.